What's the point of health without food? We'll definitely get back to that food later on. But hey, come on, it's time for health. And today we're discussing health screening, a panacea to healthy living. We have Dr. Awojumobi Oluwakemi. Now, she's a passionate and a dedicated consultant, of course, in health matters and all that. It's great to have you. You're welcome.
Thank you very much.
You're welcome. All right, so let's get straight to it. Health, what do you mean when you say screening, health screening or screening? A screening test. What is a screening test?
Thank you very much. So a screening test is basically a test that is done to detect or identify potential health disorders or diseases in an individual who hasn't manifested with any clinical signs and symptoms yet. So the basic of health screening is that you want to identify an apparently healthy population before they start manifesting diseases. And the goal is this: you want to detect the disease early, you want to identify disease early so that you can commence early treatment and management. And this in turn will translate to a better quality of life for the patient, a better chance at cure, better management. Screening tests ideally are not the same thing as diagnostic tests. But what screening tests would do is to identify, after you screen a vast number of people, you can then identify the subset of people who would benefit from further additional tests to rule out the presence or absence of disease. Okay,
so you're talking about, now this is something that has to be done to, it's more or less like a medical survey. Can I, like you're taking a community of people and all that, it's a general thing and all of that, yeah? All right, so how do you know that a screening test is done well?
Okay, so there are certain qualities that you want to look out for when you are trying to do certain screening tests on people. First thing, a screening test must be affordable. You don't want something that is so expensive and then people really cannot benefit from it. A screening test should be readily available. You don't want something like a screening test only available in a certain center, in a whole state, or in a certain geopolitical zone. A good screening test actually should be applicable to a vast number of people.
Okay, yes.
At the same time. And a good screening test should be sensitive, should be able to identify even the minutest level of disease in an individual before this disease or disorder becomes clinically apparent. Also, a good screening test should, as I said earlier on, should be applicable to a vast number of people. And I think I want to commend and acknowledge the efforts of the Lagos State government, what they are doing recently. We have quite a number of primary healthcare centers being established in certain both urban and rural areas, sort of bringing healthcare closer to the masses.
But are people enlightened about this?
Yes,
how important it is?
I think they have. We have quite a number of healthcare awareness, screening awareness. You should have, as a woman, you should have pap smear done once you're sexually active. As a man at a certain age, you should have your PSA checked to rule out prostate cancer. Quite a number of things have been done. Okay,
yes, they have been done now, but I would say that not so many people know about this. What else can be done to ensure that the information about this is further, disseminated to the grassroots level? Because it is something that it is not everybody as much as we would want. I don't think the information is out there as much as we would want.
Okay, a good way to ensure that there's dissemination is healthcare advocacy. You advocate, you're putting policies in place to ensure that, okay, it's mandatory that at a certain point in their life, at a certain age, a man has to undergo this certain screening test. A woman has to undergo this certain screening test. And then most importantly, grassroots. So we're talking about, going back to the primary healthcare centers.
Definitely, definitely.
Is your surest and easiest way to get to the masses faster. Because once you have these centers established in rural areas and urban areas and they're nearer to people, it's more likely that people would visit them, make use of them. And then when you have trained healthcare workers, not even necessarily nurses or doctors, these community health extension workers telling
volunteers,
people,
those ones that, that go around.
Yes, that go around and they go about telling people why they need to screen and how they are going to fare better if diseases are detected even before they become clinically obvious and abnormal.
Okay, now to people who have not done a screening test, what does a screening test entail? What does it look like? Do I just go? What happens in an example of a screening test?
Okay, so when you're talking about the screening tests ideally are tailored to specific individuals, and part of the factors that you look at when you're looking at a screening test, you're looking at the gender, the male or female, so there are peculiar screening tests.
Peculiar kind of tests.
Yes.
Okay, so which one can we expatiate on so that people can just have an idea what actually happens when you go for a screening test? What actually happens?
So let me give you an hypothetical example.
Yes,
and
please.
This is what happens in a lot of cases.
Okay.
Let's say this lady, let's call her Funke, comes in, she routinely has a mammogram done. Okay. And then on one of the mammogram screening, a tiny node was detected. Okay. And this node is so tiny, we call it subclinical because she can't feel it herself.
Yes,
but it was picked by the mammogram.
By the mammogram, okay.
And then she goes on to have this node checked out, and it's discovered to be malignant, that is cancerous.
Yes, cancerous,
and immediately she has that entire node removed. Now we are talking about a possible cure for this Funke lady. Okay. Now imagine a situation where she doesn't have a routine mammogram done, and then this node alone grows up to now become clinically obvious. Either she detects it herself or her partner detects it.
So you're saying that before the node becomes full-blown cancer, it can be taken out without...
Yes, and you're talking about a cure before spread, before metastasis.
Okay.
And so for individuals with previous family history, especially in first-degree relatives, you want to screen them faster, you want to screen them earlier, and you want to screen them more often.
Okay, now this is quite enlightening. There's good. You don't have to feel anything.
No.
Stand up and go for a screening test.
That is the exact.
Is it free? It's not. You said it, but it's affordable.
It is affordable.
Okay.
Okay, it's quite affordable, and then at the end of the day, you are better off.
Okay, so I can just stand up, go to a primary healthcare center around me, and ask for a screening test depending on my gender and my age and all of that. They will know what kind of screening test I would need. Yes. Thank you so very much, Doctor. This was quite enlightening. I would definitely find a way to go for a screening test myself. All right, thank you. It was good having you. And of course, I hope you've learned something from this one. Go for a screening test. It could really save your life. We'll take a time out now. When we get back, the second lap of the show kicks off.